I'm Chief Executive of PCAVS, but also pleased to also be the co-chair with Councillor Lyle for the Community Planning Partnership Board. Councillor Lyle would have normally been chairing. I think was his turn today, but he's attending an important meeting of council leaders at COSLA. So he's asked me to chair today, and if you're all happy about that, I'm pleased to do that. One or two just wee preliminary matters. We just so you know, we will be filmed today as part of the transparency around the partnership meetings, and the film of today's meeting will be posted on the council's YouTube channel. I think the ratings were quite high the last time, so we've got a lot to live up to. I mentioned that Councillor Lyle was not with us today. Councillor Ros McCall, pleased to see Councillor McCall here, substituting for Councillor Lyle. I have some apologies noted to me. Emma Fletcher, who is the new Director of Public Health, Benish's Tayside, and we're pleased to have Anne Erickson substituting for Emma today. So welcome, Anne. Also, in terms of Police Scotland, pleased to welcome, I think it's a welcome back to Nicola Russell, who Nicola has been involved in community planning here in Perth and Kinross over the years. So welcome back, Nicola. Pleased to see you.
Morning, thanks.
I have apologies noted here from Gordon Patterson from the Health and Social Care Partnership, Councillor Andrew Parrott, Councillor Gray, are you substituting for Councillor Parrott? Yes.
Indeed, yes.
Welcome. And Kirsten, is there any other apologies I haven't noted?
Yes, we now have apologies from Bill Nichol, NHS, we also from Michael Wright, Scottish Enterprise, and we have apologies from Councillor McDade. Thanks
very much, Kirsten. I think we'll move on to the substantive agenda. I think in terms of how we'll structure the meeting, if you can try when you're not talking, because there's quite a lot of us, to be on mute, and remotely put your yellow hand up and I'll try and bring you in. Please feel free to make any comments on the chat, and David and Lee will keep me right if I'm missing any of the comments that are coming in through the chat function, and keep me right in general, basically. So as we go, we'll move on to item 2 on the agenda, declarations of interest. Do we have any? No, thank you very much. And so we'll move on to the minute of the Partnership Board from the 12th of October. I think we'll just go through that page by page and take any items of accuracy or matters arising. Page 1, page 2, and page 3. Good, thanks. I think you'll see from the meeting, the last meeting, it kind of sets us up well for our agenda today, and the next stage of those discussions around the revision of the LOIP, and how that links into the Perth and Kinross offer. Then the next steps, I think that's the main aim for us today, is just to move that step forward in terms of the refreshing and the revising of our joint work in terms of the board. So moving on to the first substantive item, item 4, the Local Outcomes Improvement Plan Annual Performance Report. I think David Stokoe was going to give us a quick verbal update. David?
Yes, thanks, Chair. So just to remind colleagues, and hopefully you've had an opportunity to look at the draft annual performance report that was sent out with the papers, but we're required as a partnership to publish an annual report which sets out our progress against the local outcomes improvement plan, which I'll refer to as the LOIP for the rest of this bit, because that's quite a mouthful to keep saying. So this report runs from October 2019 to the end of September 2020. It sets out our partnership work across the 5 strategic objectives that are set out in the LOIP with case studies. Clearly this year there's a strong emphasis and focus on the partnership work in response to COVID. So you'll see that, and that sets out various partnership responses and how we supported communities. It's important that the document does reflect all the partnership work that we've done, and we'd ask any partner who is yet to contribute or send any information in, or has looked at the draft LOIP and felt that they could add a little bit more to that, to do that before Christmas break. The executive officer group of the partnership, which some of you are also members of, reviewed this a couple of weeks back and felt that there was more to add in. And thank you to those partners who, on the back of that meeting, have sent information. We've still got a few gaps, so it would be good if your organisation hasn't contributed to do that. What we're looking for really is what any case study that you contribute is be clear about what was the outcomes and the impact of that work. Is there any statistical information to support that and evidence that? And we're particularly interested if there's any qualitative information as well, and anything from your communities of place or interest, or your client group, which sets out, which describes the difference that made for them. So have a look. If you feel like there's gaps in there for your organisation, then you can send it to me or Lee Haxton or Christopher Holgate. I think Christopher sent a couple of emails out, which with the draft paper, so you should have his email address. But if not, you can send it to any of us, and we'll add that in, and we will collate that early in the new year and send round CPP board by email for sign off. So happy to take any questions on that, Chair.
Yeah. Any questions for David? No, I think just to reinforce something that we've discussed in the past about, I think it's important that we focus on where there's been added value through the partnership working in terms of the LOIP and other reporting. So particularly where we can evidence, as David says, where we have evidence where that partnership has added value to the outcome. I think, and importantly, we'd much rather have a number of things where we can see that these things have happened because of community planning rather than business as usual. So thanks to everyone who's contributed so far, and please get those partnership case studies and outcomes into David. Then we'll circulate it to the board in January, I believe. Barbara, do you want to come in?
Thank you, Paul. It's just to say that, sort of on reflection, we obviously always take the annual performance report and an update to council. So we would be really keen to get as much, sort of in terms of partnership working within that, because it's always a question that comes up asked by our elected members for more information about that. So the more that we've got, then, sort of the better, feedback, and the more reassured our elected members who aren't as involved in the CPP, sort of are that there is strong partnership working taking place. So the more information we've got that can enhance that, that would be great. So thank you. Thanks,
Barbara. And thanks in anticipation, everyone, for your contributions to the improvement plan report this year. So I think we'll move on to, I think, Barbara, is that a legacy hand? Yeah.
Yes.
I learned that term yesterday, so I might use it. It's quite fresh to me.
It's an Emma Fletcher word.
Right, so move on to item 5 on the agenda, revised local outcomes improvement plan. I'll pass over in a minute to Fiona, who will present the paper, which outlines a revised proposed structure in terms of the LOIP based on the work that we did as a partnership board during the summer, the Short Life Working Group and the Executive Officer Group that discussed and looked at the revised priorities. And I think what the paper does is outline a revised and refreshed way of working to develop and I'll use the word again, refreshed approach in terms of the LOIP going forward. So I'll ask Fiona to present the paper, then we'll take questions for Fiona and observations, and then we'll move on to the discussion about the offer, the Perth and Kinross offer, and then what I would propose that we do is that we try and tie things up by returning to the recommendations in Fiona's report. But I'll pass over to Fiona now to present that paper 5.
Okay, thanks, Paul. Morning, everybody. I'll just briefly take you through the report because, as Paul said, it actually connects into most of the rest of the agenda. And just a quick word of thanks as well to members of CPOG who contributed to this paper. They had a discussion about it a couple of weeks ago. But just a quick reminder, as they used to say on blind date, of what we discussed and agreed at the last board meeting back in October. And what we talked about then, and Gordon summarised for us, was the the priorities within the priorities, if you like, that have emerged for the CPP partners over the course of this year, and particularly driven by COVID. Some of the issues already existed and were well known to us, but they've become even more important for the partnership because of COVID. So section 3 of the paper just re-summarises what those issues were. There was a short life working group ably steered by Gordon who had a look at that. Section 4 of the paper then talks about how we build the priorities for the CPP, which are fundamentally about equality and addressing stubborn inequality into the wider Perth and Kinross offer. My way of looking at the Perth and Kinross offer, but it might be useful just to have a bit of discussion about this to check that we're all on the same page. My way of looking at the offer is it is the overarching plan for what we want to see happen in our area for our people and our communities. Now, some of what we want to see delivered through the offer is about inequality. Some of it isn't. And the LOIP, if we go back to the Community Empowerment Act, is the founding legislation which really reminds us what a LOIP is supposed to focus on, and it's about targeting, seeking out and destroying stubborn inequality. So section 4 of the paper talks about how we are proposing to build these priorities for the CPP within the wider offer. And as colleagues I think are mostly aware, there are some key strands to the offer around equality, education, economy, empowerment, etc., etc. And we talk in section 4 about how we think CPP priorities fit within that broader picture. Section 5 then talks about delivery. What David and Lee have mapped out for you there is existing working groups, because what we don't want to do is, in terms of delivery, set up a whole new load of working groups and forums and process, which we then have to service. So there's quite a lot of activity already going on in relation to these priorities, and we've just set that out for you there. And finally, section 5 and 6 talks about how we then get going on delivery. You might remember the council chief executive, those of you who are at board, in October, talking really powerfully about, it's easy to have a 10-year plan. At the moment, the LOIP is a 10-year plan, and it's easy to say things like, within 10 years, we'll reduce child poverty by 10% or whatever it is. Let's really hone down to what are we going to do in the next 12 months, 24 months, 36 months to make traction against these issues, particularly things like food poverty, fuel poverty, digital participation, which we know are now more critical than ever before. And Section 7 finally sets out the recommendations for you to consider as a board. But as Paul says, it probably makes sense to work through the rest of the agenda. We've got a presentation to come from Charlene Guild, who's leading on the offer, and then return to these. But happy, Paul, to take any questions just in terms of clarity or anything I've not explained very well on the paper.
Yeah, thanks very much, Fiona. Any initial questions in terms of the content of the paper? Anyone want to make any comments at this stage before we move on to the offer and Charlene's presentation? And
sorry, Paul, one thing I should have added there just in terms of governance, partly because this is something that John McNerney and I have discussed at various points over the last few years. There is a proposal to ensure that we have a risk profile for delivering the new LOIP, because that's something that I think we've talked about before is really important for the CPP board to understand delivery progress, identify slippage and risk, and take actions and decisions to mitigate risk.
Yeah, well, I certainly welcome that focus. I mean, I'll let you come in a minute, David. I mean, I just want, just as a general point, I think one of the things I want to see from today is a move towards us as a board being able to talk more about the issues rather than the pro, and more about where we can identify through the new structures and the new planning framework where there are areas where we need to work together more, and we can have more discussions about the what we're doing. And I think today's discussion will allow us to hopefully revise and refresh the structures and give us more opportunity to have more of those discussions rather than getting bogged down in the planning structures themselves. So I'll take David in and then Anne.
Yeah, thanks, Paul. You've teed me up nicely there. Actually, I'd just like to take colleagues back to July 2019, which, apart from being pre-COVID, was a lovely, warm and sunny day when we had the workshop in 2 High Street with CPP board, and we talked about how board was functioning and the essence of that, which is in the paper, but I think is worth emphasising, is, as Paul has said, board should be focusing on those issues and actions that can only be resolved through a collective effort of the partners, and which are our key wicked issues, if you like, which Fiona has talked about in terms of what we need to seek and destroy. The LOIP shouldn't be business as usual, and board very strongly said that they didn't want to be just signing off strategies and plans, which are always interesting and have value and are good for us to know, but board actually wanted to be able to shape the actions and response to those things and actually really understand those issues in a way which Paul has described. So the reason there are only those 5 priorities, which are big, they are chunky things when you get into them, but they are the things that that board should be focusing on as the big things, where there is a significant partner contribution, because no service or organisation on its own can resolve that. So it's just worth bearing that in mind as the discussion continues. Thanks, Paul.
Sorry, Anne.
Thanks, Paul. And really, it's partly to follow on from that, and just to say that I very much welcome the report. It's very clear. My question, though, is if what we're being tasked to do is to seek out and destroy those stubborn areas of inequality, it's the extent to which we actually really understand and know exactly what they are and how we bring that laser focus to those areas that we need to tackle. But we're being challenged clearly to step up, and COVID makes that even more important than it ever has been. And so the question is, how confident are we that the arrangements we have in place are going to be up to that challenge? And what more can we do as a partnership to make sure they're as effective as possible? What else do all of the partners need to bring to this to make sure that the people living in Perth and Kinross have got the best chance of us all collectively succeeding in that task?
Okay, so there's a question there about use of data, and there's a question about governance, and is our structure fit for purpose in terms of delivery, Anne? Is that right? Yeah.
Yes.
Okay.
And,
so,
it's particularly in the light of COVID. So COVID has been very negative in many respects in terms of that it compounds existing inequalities, but it's also brought us opportunities, and I would say opportunities as a partnership to demonstrate what we do really, really well and the strength of the partnerships across Tayside. So it's what can we take out of the learning in the last 9 months to exploit that better so that we actually have a better chance of success here.
Okay, so on the data question, and I think Charlene, when she gives her presentation, might want to just briefly recap on some of the impact assessment that the council and partners have been doing in light of COVID. And I think what I would say, though, about data is, I mean, you're absolutely right, and you probably won't find a more passionate advocate than me of having data-led approaches to what we do. At the same time, though, you know, a lot of these issues have been around, maybe it's just me, maybe I've been around too long, but a lot of these issues have been around for a long, long time. And a lot of them are not new to us, whilst they have been exacerbated or brought to the fore through COVID. So I think as a partnership, we have to be careful to make sure we are data-led and evidence-led in our approach. And at the same time, though, we're not distracting ourselves with doing further data analysis or gathering or data mapping that actually is sort of probably going to tell us what we already know once we've completed it. But David and Charlene might want to add to that. On the governance question, and are we properly mobilised in the way that we need to be to deliver what's a very challenging set of priorities? I think probably the answer to that bluntly is at the moment not yet, and that's what a lot of this paper is about. It does propose a more streamlined delivery structure, and I think I would also underline what David's just said, which is that a lot of the LOIP, and we're not in any way unusual. I mean, John may want to comment on this. I don't think we're in any way unusual, but a lot of the LOIP, when you look at it, does contain an awful lot of business as usual. And therefore, you know, our delivery focus and our governance and delivery structures, once you strip out that business as usual and focus on what, as David says, you know, what is it that collectively the CPP has to do, i.e. 2 or more partners. It's not going to be everybody all of the time to get stuff done.
Thanks, Fiona. I've got a number of people waiting. I think just to maybe reinforce in terms of my views, I think we've got an opportunity here in terms of that governance, in terms of the structures to look at more flexible ways of coming together and developing and planning and delivering work. So I think the one size fits all of a kind of committee structure, I think this is an opportunity to kind of look at that, and keeping in mind that old phrase about form, full and function. So what we need to do in terms of digital participation may be completely different to what we need to do in terms of food poverty, and how we come together and how we plan to do things. So I'm going to take Councillor Gray, then Nicola, and then John before we maybe go on to hear Charlene.
Yes, thank you, Paul. Having been a remote from this process, at what stage do you envisage local action partnerships becoming engaged in the process?
I think I'll maybe ask Fiona or David to. I think they are. You know, there's intention that they will continue to be part of the different layers that feed into this, but just obviously have that geographical focus. But David.
Yes, it's a good question, Councillor. Thank you. The action partnerships were actually all in the process of refreshing their own action plans at the start of this year, and of course that had to stop because of COVID. But I've shared the priorities that are outlined out in the paper with a couple of the action partnerships, which is useful because it's a bit of a sense check with what I like to call real people, because these are community reps who've gone through this, you know, live in this, and certainly they've agreed that if they wrote a list themselves, that it would broadly be similar. I think in our rural communities, maybe the mental well-being would have perhaps a bit more of a focus on isolation, social isolation. So that will need to be a feature. But what we would be saying to action partnerships is, here's the key priorities for the LOIP. There may be some, what does that look like in a local area? There may be some other things in there that action partnerships sees as a significant issue for them. But I think those five priorities would be key and provide the golden thread, if you like.
Thanks, David.
Thank you, David. I asked that question really on behalf of these real people who do sometimes talk about bring up the local action partnership and ask where they are at the moment.
I think that's helpful, Councillor Gray. I think one of the things that we will need to discuss going forward is how we broaden out awareness and involvement across the whole community planning process, and as well as not losing sight of the important role for the locality partnerships, making sure that we involve communities of interest, people that share an interest or an equality characteristic or an aim or an ambition that aren't within only one geographical area, to make sure that, you know, people who have a voice, whether it's equalities groups or groups with a particular interest, so we have a flexible enough structure that people can feel part of that as we go forward. So that's part of the challenge for us, but also a good opportunity to get more people involved. I think Nicola, can I ask you?
Yes, thanks, Chair. Just probably a couple of observations in from my perspective. I think I like the objectives. I totally understand what we're trying to achieve by having those high level above and beyond priorities, if you like. But there's a role for the partners, you know, and I obviously speak from a policing perspective to make sure that we're aligned underneath this, because actually I have a local police plan that services a variety of different outcomes that we're obviously questioned on and held accountable for through a scrutiny process. So we just need to make sure that actually we're talking the same language and then all delivering towards delivering those outcomes. And you know, I've spoken with David about this, and I'm entirely comfortable with what we're doing in a policing perspective that we can feed into these. But aspirationally, you know, I think as a partnership, we would all just like one LOIP that highlighted actually what the priorities were. We're not there, we're not in that space. You know, we couldn't, from a policing perspective, couldn't just rely, I don't think, on saying here's the LOIP and here's the outcomes, and this is what we will only speak to. So there's a bit of work there, I just think, for individual partners, and it probably comes back into that point that Anne makes around are we actually set up accordingly to deliver this? And I think the other element that sits underneath that is making sure we've got the right people going to the right meetings or the right boards and the right programmes to actually be able to deliver some tangible outcomes as a partnership. So I welcome it. You know, we have a statutory responsibility to be involved in this, and like I say, I've spoken a couple of times now to David about the passion and enthusiasm we have from a policing perspective in order to deliver this. So so it was just really to highlight those points. Thanks, Paul.
Well, that's really welcome, Nicola, and I think, you know, we'll really value your input going forward. And just that point, you know, we will all, as individual organisations, have our own accountabilities and our own priorities. You know, in your policing plan and my strategic plan for my organisation and corporate plan for the council, for example. But where the partnership can add value and where we can only achieve some of these ambitions that we're starting to develop together, to have those in one plan that we're all working towards will be helpful. And I think everyone's input into developing that through these sort of discussions as we go forward will be really valued. So thanks, Nicola. And John.
Thanks, Chair. Just very briefly, I think the paper is very clear and helpful in focusing on key priorities. And I think the overview from Fiona is also very clear. I agree with Fiona that on data, which was the original reason for putting my hand up, you don't obviously want to make an industry out of finding out what you already know. But data sharing is important, and I wonder if well, how clear you are on the types of data that you do want to share and focus on, and also a bit of an offer if there's anything that we can do to help in terms of describing that spatially, and whether that would add any value. I'm not sure how big a task you think the data sharing is, but well, it's an offer, and happy to speak to you about that, Fiona and David, as well as a governance point that Fiona flagged. Okay, thank you.
There. Thanks very much, John. I'm sure that offer will be very much welcomed by the partnership. Thanks very much. Nicola, you still have a hand. Is it do you want to come back in? No. Okay, good. So I think that's been really valuable discussion. I think we'll now move on to Charlene, who is joining us, and Charlene's give us a presentation on the offer and then help facilitate a discussion around the offer, and then we can return to the recommendations in Fiona's report.
Good morning, everyone. Thank you for inviting me along. I was at CPOG last week and we started to discuss the offer, and what became quite clear was there's been a little bit of a reshuffle with some of the members of the CPP board, and not everyone was up to speed on what the offer was, where we were with it, and the progress. So today's presentation will take us back a year or so. Apologies for those of you who have been more involved in this process and have heard some of this before. I think it's important that we move forward with everyone knowing exactly what we mean by the offer and the work that has gone on in the past year. So I am more than happy to take questions or comments or suggestions at the end of the presentation. Can we just move on, please? Thanks. So the concept of the offer came around about 18 months ago now, and it's about how we address our relationships with all of the different partners, citizens, individuals, communities, investors, and how we work with them. So moving away from only traditional models of public service. That doesn't mean to say that we will be changing radically every single thing that we do, because obviously we have these statutory responsibilities and we may find new ways of working with people, but we're not just going to throw everything out that's good. We know that there's lots of good practice out there, but what we want to do is really capitalise upon that and start to find new ways of working with people. So working differently with our partners, with our individuals in the organisation, with communities, to agree priorities and really have a sense of co-creation and collaboration with our communities. and obviously aligning our budgets with those ambitions. So really targeting our collective resources where they'll have greatest impact. And to do that, what we need to think about is those localities and the issues that are coming up for them within the locations where they are in terms of services and how we deliver those locally. Can we just move on, please? Thank you. So last December, we took a report about the priorities for 2020 to full council, and those were split between external focused ambitions and internal focus. So you'll see there that building our Perth and Kinross offer vision, again, very much an external focus. So we had real ambitions in 2020 to have a very, very full consultation process with partners, with our communities, really just getting those key messages from people, those key themes around what was important to them and what we needed to do to build on our Perth and Kinross offer concept and really bring it to life, and be able to just take that forward in terms of the actions that we were going to have. Internally, we wanted to create a communication and engagement plan. We had, again, I think I've just mentioned that, we had great ambitions to go out and have a very, very wide scale engagement and consultation exercise. Obviously, that's been curtailed somewhat due to our current circumstances, but we have done what we could in terms of our virtual communication. So I'll touch upon that later in the presentation. We also wanted to develop our employee experience internally. What we're very, very clear about is that actually to make these changes will require some cultural change within the organisation. And we've put together an organisational development plan that, again, we're hoping that there will be opportunities to share ideas and experiences with our partners in terms of training, development and learning for our staff and the way we do things around here and the way we work with our partners and our communities. Promoting quick wins and successes was another aspect to our vision for 2020 in terms of just pulling those things together. So building a portfolio of case studies in terms of what's worked in terms of this concept. Where do we already see the Perth and Kinross offer in practice in our communities, within our organisations, and how do we promote these to show what good practice could look like and how this could work for everyone involved. And finally, enhancing our digital engagement platforms. So starting to think about, well, how do we actually ensure people can get online if they need to? How can we make sure we're consulting with people, not only face to face, as we thought then, but also online? And I suppose that's become critical in the past year or so. Next slide, please. Thank you. So obviously we moved into 2020 with great ambitions for all of those 5 priorities in terms of the Perth and Kinross offer. And come March 2020, the landscape changed dramatically, as we all know. So we started with rapid transformation to the way that we operated. So we've had new ways of working. There's been the continued delivery of our 18 essential services. We have found members of staff stepping into unfamiliar but extremely vital new roles. We have had people retasked into social care. So what we've really seen right across our workforce is a flexibility like never before. We've had a massive change in our working practices. I mean, if I'd said almost a year ago that we would be working singularly on Microsoft Teams, I think people would have laughed in my face, but that has happened. We've showed more agility, commitment and flexibility than ever before, and there really has been that commitment to a think yes approach. So we have been trusted to get on and just do it, and there's been radical changes in how we've delivered those services. We've had much closer working with our communities and volunteers over this period, and what we've had to do really quickly was prioritise on the focus for the people who are most vulnerable in our communities. So there's been all sorts of different structures put into place to support those people. And again, I think we felt back in sort of June, July time that this would be a time to get into that recovery and renewal process. And As it happens, this has become a much, much longer race. I think someone has used the analogy as we thought it might have been a sprint, but actually this has turned out to be a marathon. And what we started to do was look at our recovery and renewal journey and align that with our priorities from the Perth and Kinross offer. So using those E's, so equalities, empowerment and fairness, economy, education and environment. And what we did is we aligned our recovery and renewal journey with those 4 work streams within the Perth and Kinross offer. However, as we've worked on those over the past few months, what's become clear is that our recovery and renewal journey is actually our Perth and Kinross offer in practice, and the actions within that will hopefully allow us to start to demonstrate those concepts and those visions for working much more collaboratively with our communities. Next slide, please. So in terms of developing our priorities during the pandemic, we've very much kept an eye on the 5 priorities that we committed to in December and were agreed by Council. So I'm just going to give a very quick update on where we've got with that. So in terms of building our Perth and Kinross offer vision, what I would like to do is just provide assurance that nothing is set in stone yet. We need to have these discussions with the Community Planning Partnership Board, and we need to agree and define our vision together. So phase 1 was really about discovering what people were saying they wanted, the impacts of the pandemic on people over the past 3 or 4 months. And we started this back in July, and we've worked engaging with our communities, with all of the different organisations, with our businesses and with individuals in Perth and Kinross. Phase 2, which again has just started and we're planning for that now. We're hoping to start some of these discussions in January, and we already have a date in for a workshop with the Community Planning Partnership Board, so we can discuss that further. So what we're really starting to look at now is the development of our vision. What do we actually mean by the offer, and how are we going to do this? How are we going to move forward with it? So our approach and the potential new models for service delivery. We are hoping that this will be agreed by the end of March 21 and allow us to move into our implementation phase, so delivering on the offer and designing that as we go along, so that having that flexible, collaborative and co-creative approach that will allow us to continue to listen and engage with people as we move along. Next slide, please. So in terms of phase 1 and that communication and engagement phase, so that discovering what actually the impacts were for people out there. This is just a quick summary of some of the engagement that we've had. So we've carried out internally with our staff 2 health and wellbeing surveys. Again, we've had a real focus on health and wellbeing this year, given the demands and the pressures of our emergency response. We also had a staff impact questionnaire on how COVID has affected people internally, and given that something like 86% of our staff are actually citizens of Perth and Kinross, again, that's been very telling for us in terms of the impacts in the wider area as well as internally on the council. We also carried out an external engagement survey, which we promoted through our social media channels, and again, about 800 responses to that. Community impact assessment survey, so we sent out a survey to around 300 of our key partners within Perth and Kinross, asking them how their communities or their service users, their clients have been impacted. We have also carried out 2 business barometers, one in June and one in September, asking our local businesses and national businesses within Perth and Kinross, again, the impact upon them and how they see the future. We have also held 10 wards meetings. So again, we invited community representatives as well as our elected members within each ward between July and December to have a really detailed discussion about the work that they've been carrying out during the pandemic, some of the community work that's been going on, and how they think we could go forward, not only with continuing on with some of those community engagement methods that they've been using, but also in terms of the Perth and Kinross offer and what the council could do to get involved. We've also spoken to a number of equality groups, and our equality teams have worked really hard on pulling those groups together. given some of the challenges we've had there with digital participation and just really pulling those groups together, we've done a really good job of getting feedback based upon protected characteristics and how the impacts have been different. And obviously we've shared data between partners, so we have been speaking to other organisations, other partners, to see the sorts of feedback that they have also been getting. Okay, next slide, please. Okay, so in terms of that feedback, some of the key themes that have been coming through around isolation, loneliness, mental well-being through this time, given that we've had lockdown, we've had lots of feedback in terms of those issues. We've feedback on the communication challenges for some groups, and again, digital connectivity issues, increased unemployment, reduction in social activities, and again, how that leads to that isolation, loneliness, mental well-being, the homeschooling and caring, work responsibilities. So we've had lots of feedback there about locality working. We've also had some really uplifting stories from the community about how they've rallied around each other, how we have seen neighbourliness in a way that we've probably not seen for a lot of years. So people really getting to know their neighbours, offering to help out with shopping, with just cutting grass and helping with just the simplest of tasks, but how that has meant so much to people. Now, we do have a full analysis, which I think has already been made available to Community Planning Partnerships members, but if that is something that you would like me to resend, then I'm more than happy to do that. Next slide, please. So I just wanted to revisit some of the Community Planning Partnership emerging priorities and really look at just the similarities between the feedback that we've been getting, the key themes and issues that we've had over the past 6 months. And actually you'll see where they have really chimed with the board in July 2020, the working group of October 2020. So we are all hearing the same things, which is comforting, that actually the things that we are focusing on as a Community Planning Partnership Board are the issues that people are highlighting as something that is immediate and close to their hearts at the moment. So you'll see the digital exclusion and connectivity, poverty. So we've had that raised in terms of unemployment, child poverty, businesses perhaps struggling through this time. Again, mental well-being and physical well-being has been highlighted, probably the most highlighted issue that we've had. So again, very, very in keeping with what the Community Planning Partnership emerging priorities are. Next slide, please. So in terms of phase 1, again, discovering and developing on our employee experience. So we've had a number of different ways in which we've engaged with staff over the past 6 months. We have really developed our health and wellbeing work. And actually what we want to do is start to really build upon some of the things that we have seen evident over the past 9 months. So that agility and flexibility, that risk positive approach, that just do it, let's think yes, our partnership with key community groups. So really focusing on these inequality issues in communities, food poverty, rural transport, and working at pace. So really importantly, what we've heard a lot of is we've had the opportunity to work quickly, to respond immediately to what our communities are saying, and really put in those timely interventions that were required for communities to allow them to support their most vulnerable citizens. So how we're going to do that is, is through our organisational development plan. We appreciate that we've started lots of work with our internal colleagues just on pushing those things through. But again, we know that this is a really, really wider scale cultural change. So our organisational development plan, which was approved by Full Council in October 2020, is concentrated on 4 key programmes of work. So enabling cultural change, starting to really embed some of the key areas that we've seen this year. So again, that think yes approach, that risk positive approach, and really how do we move more quickly and improve that pace. So developing our leaders is another area that we're looking to really work on in the next year. maximising potential with our staff. So again, that succession planning moving forward. And one of our key priorities, again, nurturing good health and well-being. So I think we would all agree that this has been a really big issue for us this year in just keeping people safe, healthy, and looking after their well-being, be that internally or externally. So some of the ways that we're planning on doing this is through coaching, resilience, our frontline leadership, really looking at the community capacity building that's out there to allow our communities to continue doing the work and really helping each other out that they're doing. So that delivery of that Think Yes. So in terms of our community members, we've also committed to making some of that training information and those learning opportunities available to them to continue enabling that effective participation. And hopefully as we move forward, there will be joint working opportunities or shared learning that we can have within the CPP board around about some of that cultural change to really embed that Perth and Kinross offer ethos. Next slide, please. So again, our key wins and successes over the past year. It's not been the year that we've expected in terms of the Perth and Kinross offer. We've not been able to do all of that external engagement, but nevertheless, we have seen some really positive examples of the Perth and Kinross offer in practice. We have a number of case studies that we've gathered from our communities, from individuals internally as well. Again, I think I've already said this, but we have seen people display neighbourliness and getting to know their communities and the people who live next to them in a way that's perhaps not happened for many decades. We have been working jointly with our communities to support vulnerable people, helping with food deliveries, just even small tasks, making sure people have the medicine that they require. Groups were set up really quickly to answer the needs of their own communities. They've been managing their own income. They've been keeping in touch with us for support and assistance when they've required it, and we've responded to that much more quickly. In terms of our food network, we saw that grow so quickly and support our communities in a way that we've never had before. Again, supporting children with homeschooling, encouraging them to keep active and healthy, and undertaking even minor repairs within their home and maintaining green space around and about neighbourhoods. So again, lots of quick wins and successes in how we've worked together, how we've embraced that community spirit, and the appetite for that moving forward. Next slide, please. I think I mentioned at the beginning, this has become more prevalent than ever before in terms of enhancing our digital engagement platform. So there's a number of things that we've done this year, some by circumstance and an immediate need to do that, and some because, again, we've really seen an embracing of digital in a way that we never have before. So again, using Microsoft Teams for all of our meetings, those virtual and digital engagement platforms, we're also using them for our health and well-being. So we have a lockdown lounge. We have a number of different initiatives that we've put into place just to allow people to come together more informally as well as formally in terms of that. We also really quickly realised that not everyone could access our internal intranet, so we pulled together a dedicated staff website that everyone could access through their own devices and get up-to-date information about what was going on in the organisation and really just have that engagement with the organisation at a time where people were perhaps feeling quite remote and isolated. We've also really pushed forward on our video blog, so there's been much more of that this year. We've also started a Perth and Kinross podcast. So internally we have had a group of staff who've worked really hard on pulling together podcasts, just again for information, keeping people up to date, engaging with our workforce, and they've been on all sorts of issues over the past 9 months. We have had engagement with communities, residents and businesses through Microsoft Teams, through Zoom where necessary, and our social media again has been a really key way of keeping our communities, our businesses up to date and really engaging in a two-way process. So we adapted quickly and had a social media rota. We had people responding to queries and issues and challenges that people were having in the communities really quickly. Next slide, please. So next steps. Obviously, what I've done there is just given a very quick summary of our year in terms of developing the Perth and Kinross and some of the progress that we've made in this challenging year when we've been dealing with an emergency response also. So as we move forward from November and December, we've moved into Vision and Define. So we are pulling together a plan for our workshops and how we do that. And this is something that we very much see being done jointly with the CPP board. We will have ongoing communication and engagement with our staff, with our communities, through social media, and through all of the channels that I've just highlighted. We will start on the delivery of the OD plan to be able to deliver on what we're speaking about and that cultural change in terms of how we are and our way of being, the organisational development plan and our rollout of unwritten ground rules, which is our tool for starting some of those discussions in terms of cultural change, will begin early next year. We'll also continue to consider the ongoing financial and resource implications, so looking at our structures and looking at the programme management approach towards the Perth and Kinross offer and how we ensure this approach is embedded moving forward. And we've also started a governance review also that we will be reporting on as we progress that. Next slide, please. So our current vision within the community plan and the corporate plan is creating a confident, ambitious and fairer Perth and Kinross for all who live and work here. And again, the strategic objectives, which we'll all know, our 5 strategic objectives: giving every child the best start in life, developing educated, responsible and informed citizens, promoting a prosperous, inclusive and sustainable economy, supporting people to lead independent, healthy and active lives, and creating a safe and sustainable place for future generations. So again, starting to think about that current vision and how that fits in to where we want to be and how we want to work moving forward. Next slide, please. So what do we mean by vision and design then? So we want to build back a better Perth and Kinross, and we have some proposed principles, and again, they are just proposed principles, and we will be asking and hopefully working in partnership and collaborating to really get these right as we move forward. So we have bold vision, enabling, partnership and kindness, and core to our vision is that ensuring that everyone has something to offer. That was the thinking behind our Perth and Kinross offer, that actually everyone in our communities, everyone in our partnerships, our internal organisations has something to offer. So what we want to do now is build on the information that we've received, so build on that key data and really look at the key themes identified about the impact and build our vision around what people need and want moving forward. Next slide, please. So how are we going to do this then? So our step 1 is our workshop discussion. So we have a workshop I think already booked in January, and what we really need to start to think about, what is the offer, what does that mean for the Community Plan and Partnership Board, what are the key interfaces, and how do we go and develop that joint vision with high level objectives and outcomes, setting clear principles and agreeing the strategic framework for the LOIP, which again will help set that blueprint for the offer. And step 2 within that vision and exercise is to engage with our communities to test the proposed vision and priorities for the Perth and Kinross offer. So once we have agreed something and we want to move forward, we need to engage and ask, how does this look? Is this what you envisaged, and will this work for you? Okay, next slide, please. So what we will use to build our vision and objectives. So obviously, we need to think about our collective, and we need to think about our collective national strategic priorities as set out here. So we have the National Performance Framework, which again has some key principles. Our Fairer Futures work, the local intelligence. So again, we need to look at what we have already built and what we already have, those key structures, frameworks and themes that we have in place already that help us inform how we move forward. So we're not starting from a completely new place. We want to build upon all of that good work that's already been done and all of these themes and frameworks that really chime with the ethos and the concept of the Perth and Kinross offer. Okay, final slide, I think. So the planned outcomes then. So by the end of March 2021, in partnership with our communities and with our CPP boards, we will hopefully have had an agreed approach and vision, so what we can call the PK offer blueprint. We will be clear about our objectives and key priorities, and we will have these underpinned by agreed principles moving forward. So that's where we are at the moment, and that's what we are hoping to achieve. As I have said, we have there is no vision set in stone yet. This is something that we are hoping to work upon jointly with yourselves and agree a vision moving forward. I would be happy to have a discussion around how we do that. It is hoped that in January we'll have a much more in-depth discussion and have some time to really start to think about our vision moving forward, those principles and those key priorities. But I'm more than happy to take any questions that people have had around the presentation today. Thank you.
Thanks very much, Darlene. Thank you. There's a lot there. Before we go on to take questions or contributions, just say, I think it'll be very helpful to get, that date, if you do have that date already in mind, and consult with partnership boards so we can get, because I'm sure everybody would want to be involved in those discussions, and then the next steps from there. Councillor McCall.
Thank you very much indeed, Chair. Charlene, excellent presentation as usual. Thank you very much indeed. A couple of things come to mind purely from a community basis, just knowing my own ward and that sort of thing. Certainly COVID seems to have created a natural full stop to the way things were before. And obviously this is a complete, as you said, cultural change for the way we're going to work. So the community seems to be poised, ready to open up when we can to a new way of working, to a new collaborative way of progressing this. So are we in a position to utilise this re-emergence, shall we say, over the next year, or are we a ways from that yet, considering the additional communication and working together that we've got to do? And I suppose, has the engagement that we've had to redo, this virtual engagement that we've had to have with communities over the COVID pandemic, has that increased our ability to communicate, or has it hindered it? And will that be a problem moving forward? I hope those two questions make sense.
Yeah, so just to answer your first point there about communities in terms of, are we in a place to support communities? I think what we have started is a journey with our community groups. So we have been speaking, especially through the ward meetings where we've had some really detailed conversations. I think there are many community groups out there who are actually in a place where they're supporting themselves and have really pulled together very quickly to do that. We are starting to think about, well, how do we jointly work together to provide assistance, to perhaps free up time, resources and support where necessary. So I do think it's an ongoing conversation. I think as we move forward into the new year, restrictions ease, I think we'll see more examples of the Perth and Kinross offer in practice, and more community groups working with us jointly to really see some development and take what we've already started and move that forward into the future.
Thanks very much, Charlene. Anyone else? Any?
Sorry,
questions?
I just want to the second part of that, which is the virtual engagement. Has it hindered or has it helped us get into areas of the community that maybe we haven't been in before? Has it been a benefit, or are we still got sections that we just haven't managed to engage with?
Apologies, I didn't answer that. I think in some ways it has actually helped. We have reached pockets of seldom heard communities, especially in our equalities groups, we've perhaps not heard from before. So we have made some real contacts, and I've been to some really productive conversations online with people. So I think it has really helped. I think there are other people who really feel isolated because they're perhaps not as digitally savvy. They've not perhaps got the equipment available to them. So we've also been looking at that out within the community. So I know we've had community groups supplying members of their communities and their groups with equipment and things. We have had masses of responses, which would suggest that there are a lot of people. I think within the presentation there, we've had over 7,000 responses from people. But I think what we need to do is consider those people who perhaps have been quite isolated during this time and have no access to using digital means of engagement. What we have done is we have also engaged through community groups who are out speaking to those people and are working with people perhaps who have not directly been able to contact us. But yeah, I know that Lee has been taking forward a group. So again, I think Fiona's just made a comment, and David or Lee might want to come in on this point.
And could I just before I ask David or Liam, and I think a lot of what you've said, Charlene, and the question kind of resonates with me in terms of my day job around where we have seen in some ways the virtual aspects of engagement. More people have been able to engage because some people have been stuck at home, for example, and just through necessity, and even through getting the digital equipment to people who wouldn't normally use it, then supporting them to use it. Part of the challenge going forward, I think, is going to be that for some people, I mean, I'm thinking very much around like the carers, unpaid carers we work with, who are now got used to being in the house, engaging mostly through digital. How we get opportunities for them to get out of the house again and feel comfortable doing that, because a lot of people, and particularly one of the things the young carers are challenged with is that guilt when they take some time for themselves, whether it's attending peer groups or even going to school, that they're leaving the person they're caring for. So I think how we use the increased use of virtual engagement as an extra, and not lose sight of the fact that there's so much to be gained from people coming together in individual groups. In groups. I mean, just finally, in terms of the groups, homework groups we did with young carers, whilst they have continued online, there was so much more value when they came together in a group of 6 or 8 and were able to share to people with others. Well, I have this caring issue as well, and get that peer support. So it's getting that balance and using. I think that's where you were coming from with the question around how we use that as actually it's an extra now and not a substitute. And so it's expanded our engagement and involvement, particularly of vulnerable groups. So I'll ask, is it Lee or David want to come in?
We'll take this. I'll do a little bit on engagement. I'll ask Lee to say a little bit about the digital participation and Connecting Scotland. But I mean, you've covered some of it there, Paul. Certainly, what my staff were telling me about what was happening with groups is they were forming networks. They were speaking a lot more using technology. You know, people in some ways, people had more time, and actually the pace of communities increased because it wasn't kind of people weren't having to say, well, I can't make that meeting because I've got a Scouts group that week, or you know, those kind of things. So people were coming together using the technology available to share information and come to a common kind of consensus about what the emerging priorities were, and that was a huge help over the last 8 months, and as Councillor McCall said, something that we can really build on, you know, as we go in, because we have seen communities mobilise and organise and support themselves in many ways, and in areas similar to what we've been doing with the food banks and the larders, is speak to them about what is it we can help with, you know, and some of this is small things. I mean, just filing cabinets so they can keep the paperwork straight. I mean, it's a small thing. It's a few £100 for us. For them, it really helps. So it's that kind of, I think, what is the role as the council as an enabler for this, rather than us actually thinking we have to do everything in delivering. So yeah, I think we are in a good place. I think the caveat to that is groups are tired. Just like us, community groups are tired. We have to think about when we go out and speak to them, when's the right time, what we're messaging, because there's a lot. It's not just been us speaking to communities. A lot of people have been interested in how they've reacted and responded to COVID and lockdown, and so I think there's just a little bit about timing. But I think as Charlene said, as we get into next year and hopefully things improve a bit, there'll be a bit more of a bit more space for that. So it'd be useful perhaps if Lee just talks about some of the work we did around Connecting Scotland and the digital participation, because that is one of our priorities, and there's been a group working away at that. So
yeah, thanks, David. So as has been mentioned, one of the key issues that came up and has been picked up across the scale, including at CPP level, was digital participation and people's ability to get online and use online resources effectively was a huge, there was a huge increase on that as being a big focus for people going forward. Connecting Scotland is a project which is run by the Scottish Council for Voluntary Organisations, funded by Scottish Government. They've had 2 rounds so far, and the idea is effectively to get technology in the form of tablets with Wi-Fi provided into the hands of people who currently cannot do that. The first round was in the summer, and that was targeting people who were clinically vulnerable to COVID, and Perth and Kinross got a little over 200 tablets for that one. The second round is targeting care experienced young people, pregnant women, and people with young children in their household, and we're told I think it's 600 tablets will be coming to Perth and Kinross in that round that's currently being delivered now. There's a commitment to a further 2 rounds. I don't have the details of that yet. I believe the third round is going to be targeting employability issues, but I don't have that confirmed yet. So as part of that Connecting Scotland area of work that I was involved in the summer, I began to take a look at the broader aspect of digital participation, and it became clear that there are 3 main elements to that. You need good connection, you need the technology, and you need the skills, and we often deal with them separately as opposed to collectively. So we agreed to pull together what's called the Digital Participation Working Group with council and partner involvement to look at what actions we need to take in order to increase the levels of digital participation in Perth and Kinross. One of the key challenges initially is that to actually understand what the level of digital participation currently is, because we don't have statistics that are particularly reliable at a local authority level, but we've got colleagues in the information team within Perth and Kinross Council looking at that for us just now. Thanks very much, Lee.
Barbara, Fiona and Anne have posted some observations and some links and around some studies that have been done recently, which I'm sure the team can circulate to the board. There's a lot of really rich information, and I see Fiona mentioned the Joseph Rowntree Foundation, and which I think is one of the things that will inform us going forward as well, as we need to look at all the research that's going on in terms of, for priorities going forward. More generally on Charlene's presentation, are there any members of the officers group, the CPOG, who met last Friday, who had an opportunity today? Is there anything they want to contribute or reflect around their conversations, or? No. Any other questions for Charlene or observations? Because there was a lot of information there. I think it was very helpful to see the congruence between the discussions that the CPP board had in July and October with what was coming back through the community consultation. I think that's very much to be welcomed in terms of the agenda for us as we go forward. Gordon.
Oops. Might even appear as well. There you go. Yeah, thank you, Chair, and thank you, Charlene. No, I think just in reference to the meeting we had as a CPOGs, just say, I think, Charlene, you've obviously listened to the comments there and built them into the presentation. So many thanks for that. I just want to say I thought it was extremely clear, extremely well laid out, and I think it's a really good route map with time frames on it. I think though, as individual organisations, we'll have to keep in step, I think, with those timeframes as well. Probably, I don't know, but everybody's planning cycle, I think many of us probably do the kind of April to March. So no, I think it's a really, really clear route map, Chair, and just to say thanks very much for the presentation.
Thanks, Gordon. If there's no further questions or comments specifically on the presentation from Charlene, I would suggest we maybe return to the conclusion and recommendations in the revised local outcomes improvement plan paper from Fiona. Fiona, is there anything you want to add in terms of within the context of having heard Charlene's presentation, having presented your paper?
I don't think so, Paul, thanks. I'm just having a quick look at them. I mean, I think Gordon's point hopefully underlines, and the discussion that we've just had hopefully underlines to the board that what's emerged for the board itself over the course of the work that Gordon led over the summer does align and make sense to people within the wider context that Charlene's just laid out for us there. I suppose the only point I would just highlight again is just to kind of check absolute understanding. We all see the LOIP as the bit of the offer that is focused on inequality, and I don't want to kind of bang on about that boringly. It's just that we all live in worlds of strategies and plans, and it's a complicated landscape, and just being, trying to cut through some of that complexity and make sure that we're all on the same page just in terms of what this document is for, as opposed to what other documents are for, would be helpful, I think, for me and my team.
Yeah, and I think that's helpful. I think, again, it was good to see the focus on equality that came through in terms of the emerging priorities that the CPP board short life working group came up with. So, in terms of priorities for the LOIP, hopefully that'll help to address and reinforce this focus on equality. Gordon, Gordon Pride, you want to contribute.
Perfect, thank you very much, Paul. It's probably the bit of clarity I'm missing is around that very piece. It's the relationship between the LOIP and the Perth Kinross offer, what that relationship is at that top end governance level. In, was it section 2.2, the recommendation covers that the offer should be the overarching plan with the LOIP sitting under that. I'm not sure where that sits with the guidance. We've all got local fire plans, local police plans and others, and it's just how they all link in together. I feel that the information within them all work well together, but it's that top governance piece I'm just not quite getting a true understanding on yet.
Yeah, I think that's a good point. Fiona, did you want to respond?
I mean, I'm happy to, but others will want to comment as well. Gordon, I agree. I mean, I think it is complicated, and that was the reason I asked the question. But sometimes you have a bit of a sinking heart when you ask a question because it is complicated. And I think the key documents, like the ones you've mentioned, the police and fire plan, the child poverty action plan would be another example, the integrated children's services plan. These are absolutely critical, and they have a role to play in terms of that seek out and destroy inequalities. I suppose in my way of looking at things, though, they are primarily about the business as usual stuff, the absolute core day-to-day bread and butter activities that CPP partners are individually charged to deliver or to deliver in partnership with others. And the purpose of the LOIP should be to focus on the added value. So the things that the CPP can do that only it can do to tackle these priorities that we've just been discussing over and above what is business as usual. But I think it is worth, Paul, and we spoke about this in the pre-meet, just kicking this about a bit to make sure that we are all comfortable with that and that that makes sense.
Yes, and I think, you know, we all have different accountabilities in terms of all the different plans and planning. Whether the Perth and Kinross offer is the accountabilities with the communities of Perth and Kinross, and in terms of you know, the CPP board as we go forward, is that something that you know, may resonate with people? Obviously there's the accountabilities around meeting the requirements of the National Performance Framework, etc., around the LOIP. But I think it is something that we do need to discuss so we can get some sort of common understanding, because I think it is a very relevant question to be asking, Gordon.
Sorry, Paul, just to come back on that, it's really, I maybe cluttered it with bringing police and fire plan. It's more, my understanding was the local outcome improvement plan would be that overarching plan, but it was focusing very much on a small number of wicked issues we want to address, whereas the offer has a much broader cover, but maybe a bit more local authority focus more than full partnership focus at this point, and its relationship between the local authority and the community, that it's how we broaden it out to be either a CPP relationship with the community and then that becomes overarching plan, or the way it's written just now, it seems to me a bit more council and community more than multi-agency and community. Yeah. It's just that balance. I'm not. Yeah, no,
I think that's fair, Gordon. I think that's, you know, I think we need to be clear that the offer came from, you know, initially it emerged from the council, and then the council brought this to the partnership. So I'll take you in a moment, Barbara. I think in terms of, you know, and how that maybe now evolves more into a partnership offer is something that I think that presentation from Charlene maybe laid out, that visioning part, the visioning horizon, and the involvement that we're going to have more as a partnership board. It may move more towards being that partnership offer when we all feel more involved in its development, and then there'll be extended ownership in terms of that at the moment, which may address your very relevant questions, Gordon. But Barbara.
No, thank you, Paul. And those are exactly the same kind of discussions that I was having with, you know, sort of Fiona and Lee earlier on in the week. I think that, you know, sort of from my perspective, we just need to be clear. I personally think that the offer is what underpins our overall approach to delivering the LOIP. It isn't necessarily a plan that sits above anything else. But I think we really need, and that for me would be one of the main objectives from the workshop that we would have in January, is to get, you know, sort of that well laid out, well understood, and then how everybody's internal planning links to that. If that's, you know, so I think that that's the real focus for the first meeting that we would have in January. Because we're not going to solve that just now.
Yeah, and I think that's helpful, Barbara. And I mean, but I might be oversimplifying it around some of my thoughts around that the LOIP is about what we're trying to achieve, and the offer is about how we're going to go about that. To me, is ways of working. It's a cultural change, maybe, in terms of around what we're doing, but therefore that would be something that, as Barbara says, underpins the ambitions to focus and tackle inequalities which are in the LOIP. But, you know, language is really important, and to get that common understanding going forward, I think that will be helpful.
Thank you, Paul.
Yeah, and Nicola's also reinforced that through a post there on the chat, that you know, I think it is part of a journey and getting that common understanding, so we don't really focus too much on a hierarchy, but we're focused on how the offer and the LOIP, the offer may help us deliver better on the LOIP ambitions, if that's helpful. Any other contributions around the offer and any other views on the linkages and congruence between the two, or is that something that we kind of know that we need to tease out as we go forward during the visioning stage? Okay.
I think just a plea that because the workshop in January is clearly going to be really important, and it's making sure that we've got the right people there, as someone has said earlier. So the sooner we know that, the better. I'm conscious that I'm the only one here from NHS Tayside. I'm here for Emma, so I have a public health perspective. But I think it's really important that NHS Tayside is, fully committed to the partnership in Perth and Kinross, and it's making sure that we can do that through the workshop as well.
Good. No, I really welcome that, Anne. I think, if we try and give it a priority ourselves, but also, Charlene, let's try and get something organised as soon as possible so we can get that in diaries for people. Let's return to the conclusion and recommendations in terms of the report and item 5 on the agenda. I think if you're happy, we'll go through the bullet points one at a time. And so the LOIP will be a central component of the Perth and Kinross offer. I think we've just had a discussion about how those link, but I think we're agreed that that whether it's the offer's a central component of the LOIP, or the LOIP's a central component of the offer, I think we maybe need to finalise language and understanding, but I think we are agreed in principle that we want to align these processes and recognise the particular statutory duty that the LOIP has to focus on inequalities and promotion of equality. Is that fair? Good. The alignment of the priorities identified in the Short Life Working Group and the CPOG with the themes of the offer, I think we've all recognised that it was good to see how the priorities from communities through the offer engagement resonated with our work as a CPP board over the summer. So I think that's important, and keeping that in mind about how we get on to start talking about those issues and what we're going to do about it. I think we need to keep that in mind for January and going forward as a board. The proposed format for action plans, which I believe the paper outlines, see how these priorities would be delivered onwards. I think as a principle, that we need the action plans below the overall strategic objectives. I think, and would welcome views around, I think one of the good things about this paper is it does provide us with some flexibility around that issue that I said about, form, fall and function. It doesn't necessarily mean that we need to have standing committees. These priorities, it might be something that will develop differently, and certainly with regards to the board, I would like us to be thinking about, how we have conversations about these important wicked issues going forward. If we are seeing through the performance reports that we are not performing as we would like to around, for example, digital participation, do we have a specific board event or discussion which is focused on that and doesn't have like the same old set agendas. So I think an opportunity for us to think more flexibly about how we do those things, I think will come from that. I'm just talking here and hoping that people put their hands up if I say anything that doesn't reflect what we've discussed this morning. Also, the role of CPOG lead officers in helping to oversee the development and action plans and be accountable and bring things to the board for discussion. And I think we're going to have further discussions around the overall governance and accountability arrangements for the board, but as a discussion point, you know, we're going to have the meeting in January, and also I think we do have to recognise as a board is that this is quite a change that we're suggesting. We're not really sure exactly around the governance, but we know that we need to talk about that, and we know that maybe there are opportunities to improve the way we do things at the moment with regards to the standing groups that exist at the moment. One issue I would throw in there that we need to think about is around the role for outcome delivery groups. How do they work? How do they continue? Do they change? Do they have a different focus? And that's something that we need to have on our agenda around the process. But I think very importantly, and just to repeat myself again, the sooner we can get on to as a board, and I think this is where our strength can lie, to talking about those issues and how we can add value to those and add value to addressing those particular issues that we all know and we've agreed are priorities for communities as we build out the COVID and the related economic and health crisis. Any comments on anything I've said about those to summarise?
No, Paul, I think that you summarised that really well. Thank you.
Thanks, Barbara. So I think we've agreed to the approach and discussed the proposed approach in terms of the LOIP, and we've agreed the specific recommendations as I've just outlined. Again, Fiona's posted in terms of, which I think is helpful around what matters is what we do, and what we do together is very important, and to get focused on making a difference and where we add value. Where we add value will be the most important thing. So our next important date will be in January. We'll find out that soon. I'm going to just move on to any other business. I've not been notified of any other, unless anyone has anything else. Sheena.
Thank you, Paul. Just a couple of things under any other business, if I may. Yep. And I'm pleased that Nicola's still here, because Nicola, you might be able to assist with this update. But I just wanted members of the CPP to be aware, if you weren't already, about Operation Stung. And Operation Stung was a new risk that has been raised at the Children, Young People and Families Partnership by Police Scotland, relating to antisocial behaviour and some indications of young people becoming involved or at risk of becoming involved in serious offending. Youth work organisations are coalescing around the issue to provide more meaningful options and diversions for young people, and that this is very much a partnership issue and taking a partnership approach to address these issues. So I really just wanted to bring that to everybody's attention. You may have seen press releases and information on social media around Operation Stung. I noticed that in one of the most up-to-date tweets from our local police colleagues, that just this week alone there have been 15 young people who have been in different forms of engagement with the police. And what we're seeing is a core small number of young people engaging in very serious and risky behaviour, and that bit about others joining in on the periphery. So there's quite a bit of work being done with families and parents and carers of these young folks as well. And Nicola, I don't know if there was anything else you wanted to add to that, but just to say that across Education, Children's Services, Police, and with a whole range of other colleagues, we are looking to address this in a partnership approach. Thanks, Paul.
Thanks, Sheena. Nicola, could I ask
thanks.
you comments?
Thanks, Paul. Thanks, Sheena. I think really important topic ultimately when we're speaking about, especially when we're speaking about inequalities, communities, supporting the people of Perth and Kinross. COVID has hit all of us in a different way, and I think the recognition that our young people are suffering is real, and actually they're behaving in a way because probably they're frustrated. They've had difficulties throughout this year. They'll have been isolated from friends, family, school, and yes, we see some form of normality returning, for want of a better term. They're clearly looking at a way to get rid of some of that built up energy and frustration, I think is probably the polite phrase. However, the actions that they're actually being involved in and undertaking are criminal and actually really significant, and not to mention extremely high risk. And you're right, the media messages that have gone out today have highlighted links to the railway lines and underage drinking. And actually, at no time of year is that good. But at this time of year, it's particularly difficult because it's dark, it's cold, it's wet. And what we don't want is for any of those individuals to find themselves becoming seriously hurt or for them hurting others. So we are taking a partnership approach to it. Quite clearly, there's a large policing footprint, but actually, and as a partnership superintendent, for me, is about trying to prevent this happening in the first place. So where are those points of contact with those children and those families before we start to meet them at the hotspots within Perth and Kinross with their bottle of whatever that might be? And there's a variety of those. So really welcome the partnership approach, and can only thank you and the other support that we've had around how we're going to address this. And absolutely welcome any feedback from anybody around how we're doing this, especially the elected members, as to what the constituents are saying and what their concerns are. The local area commander, Graham Binney's taking a lead around it, and we're looking at various different practices from across the division and Scotland that we can implement to try and support it. But quite clearly, the message here has got to be about preventing this happening and actually mitigating the risk. So, no, thanks for bringing me in on that. It's appreciated.
Thanks, Nicola, and thanks, Sheena, for raising it. Councillor Gray.
Yeah, can I ask, Nicola, are these instances very local and confined areas, or are they kind of widespread? Give me an idea, please.
And it's fair to say the majority of them have been in Perth city centre itself. But we do have pockets, that pop up across the local authority area. But I guess probably the city and the open spaces, is as beautiful and lovely as they are, lend themselves well for children congregating and gathering out with sort of the public eye, if you like. Now, we're working really closely with the council around the data for that and the reports that we're getting in, so that we can ultimately highlight the hotspot areas. And with the wardens and officers, make sure we've got patrolling in place to prevent, if you like, in the first place.
Thank you very much.
Thanks, Nicola. Anne, you want to come in?
Thank you, and thank you very much for raising that issue. It was simply an offer. I think it's fair to say that public health and our capacity over the last 9 months has been very much sort of devoted to responding to the emergency COVID requirements around health protection, test and protect, and vaccination. But we are strengthening capacity. We have new consultants starting in the early part of 2021, and I think this is an area that I think we definitely would see as a priority in terms of children and young people, and being able to support some of the thinking and collective action around the preventative interventions around this. I think it's fair to say that even before COVID, we've seen a fracturing of services for young people in terms of the range of opportunities that young people have for other positive diversions. But it's an offer there in terms of public health being able to be more actively involved, hopefully from this sort of early part of next year.
Thanks, Anne. And I think, you know, this is an example of the sort of conversations that we should be having, and around then agreeing collective action and agreeing individual contributions to that collective action. So, Sheena, did you have something else that you want to raise?
Just to raise that through the Tayside Regional Improvement Collaborative, we have 5 different priority groups, as folks know, and one of those groups, there's a focus on mental health and wellbeing, and it's led by our colleague Elaine Cruikshanks and supported by a range of other colleagues from different services and different areas across Tayside. And in response to the work that's being done across NHS Tayside around mental health strategy, there has a strategy has been developed for children and young people, but we've also been working with our colleagues in our 3 respective health and social care partnerships as well around adult mental health and wellbeing. But we're very clear that the Tayside health strategy is the overarching one, and those separate, if you like, strategies that have been developed are key components of delivery of that overarching strategy. And an opportunity has arisen for all CPPs across Scotland to be involved in, if you like, the next iteration of improvement collaborative work that's being supported nationally. So you'll remember there was a big push on early years before, and there was the National Early Years Improvement Collaborative, and there's now a Children and Young People's Improvement Collaborative. So it was really just to raise with you that we had the opportunity to meet with colleagues from that improvement, those improvement collaborative streams of work from National Health perspective and also from Scottish Government, and to share with them the work that's been undertaken or planned to be undertaken through the collaborative. And it was really to look to see whether there was the possibility of us teaming up and taking on that quality assurance approach to improvement. So we had an initial discussion. I said I would raise that here just for your information, because it may well be something that as a partnership, it's something that the board are keen to support. So once I have more information about whether we're going to be a match for what they're thinking or not, then I would like to come back, Paul, with some more information about that, if that's possible.
Yeah, no, I think that would be very welcome. You know, our focus on mental well-being in terms of a partnership, as well as, you know, we've seen the benefits of the partnership in terms of that approach when it comes to children's services and the development of our staff and people who have gone through that, gaining that accreditation and gaining that way of working. So I think that's something that we would definitely want to hear about and be involved with again. So thanks, Sheena. And any other content business anyone has? No, thank you. I'll move on. The date of next meeting, we would normally set these dates well in advance in terms of quarterly. I think we, as we've said a number of times today, we have this opportunity to be a bit more flexible and a bit more, and it might be 3 times I've said this about form, following function. So as our function evolves differently, then maybe that meetings become different, and maybe that is more events and things like that. So that's just a long way of saying we don't have a date for the next meeting as yet, but we do have the very important meeting where we're going to come together and talk about the offer, hopefully sometime in January. So look out for that date or dates or coming out, and please make priority. And in general, Actually, it's probably the time of year where you start saying to people, I wish you a happy Christmas and New Year, because I might not see some of you. So season's greetings, and